Hey there, I'm Michele Bullock, licensed massage therapist in the state of Washington, and I like to go over everything that you need to know for the MBLEx, give you some study support. I want to help you understand concepts, and it's just an audio and video refresher for you to be able to get into that test and understand what you need to know. The reason that I make these videos is because this is how I learn best, is by just listening to people talk about specific things. And then it's a little bit easier for me to do the book learning, but generally I'm much more of an audio person. Also, I like to fidget. I like to work on activities while I'm learning things. That's how I was able to pass the MBLEx on my first try, was because I was actively listening and watching videos, listening to podcasts on the lead up, but also I did a lot of practice tests. Speaking of which, make sure and grab your free resources that are in the link tree below. There is a study guide for you that goes over exactly what you need to know. I got it from the Federation of State Massage Therapy Boards. It's a PDF form, so you can print it up and just check mark off everything that you have studied one step at a time. And also there's a 100 question practice test. That's going to be test 1. This is test 2. I also have a 10 test bundle that's available for purchase. But yeah, so 100 question practice test. If you learn best on paper, it's all the questions are set up in the MBLEx format, which is multiple choice, right? 100 questions. You make sure and set your timer for 110 minutes so that you are practiced with the time limit. That's super important. There's the answers, detailed answers. And then at the very end, there's a topic key. So you can circle all of the answers that you got wrong, so you know where you need to spend more time studying. When you're good, you got it dialed in, so you don't overstudy. So those are the freebies. What am I going to talk about today? I'm going to be talking about modalities of bodywork, which will be at least a couple of questions on your MBLEx that you're going to be tested on. So I'll just briefly discuss these modalities of bodywork that you could be tested on. Just the main ones. There's so many modalities of bodywork, but just the main ones that you're likely to be tested on. And then I'm going to talk about hydrotherapy, that's hot and cold applications, how they work, what they're for, how to use it, and the contraindications. So without any further ado, let's get into it. So the biggest one is Swedish massage. That's the massage that's predominantly used. That's the main thing that you're being taught in massage school, is how to do Swedish massage. It's the basic in Western massage. So the main benefits of Swedish massage are for reducing stress and anxiety. It's to support pain relief, not to relieve pain, because we don't do that, but we support pain relief either by relaxing the muscles or by reducing the body's perception of pain. It improves circulation, increases flexibility and range of motion, and muscle relaxation and muscle recovery from injury. So it achieves these goals by using gentle gliding, kneading, and circular movements to stimulate circulatory and lymphatic systems, break down muscle adhesions, and promote the release of mood-boosting endorphins, leading to overall physical and mental well-being. So that's the focus of Swedish massage. Let's go over what the 5 classic strokes of Swedish massage are, because you will probably be tested on these during the MBLEx. So we have effleurage, petrissage, friction, and vibration. Those are the 5 classic strokes of Swedish massage. Effleurage being the light gliding, petrissage being the kneading, tappement, vibration, right? Friction, deeper tissue, sliding back and forth over those fibers. There's cross fiber friction, which is going perpendicular to the grain, and then there's linear friction, which is going with the grain. Then there's vibration, which is shaking or rocking. Deep tissue massage is slower and deeper work into the muscle and fascia adhesions. Deep tissue massage uses techniques like stripping, that's like really pushing in deep and pulling and stripping that muscle, like really getting in there, cross fiber friction, and then trigger point therapy, which is kind of like a subset of deep tissue work to address deeper muscle layers. So just below the surface, like say underneath the trapezius, we've got the rhomboids and we've got the levator scapula. And so we're trying to access those deeper muscles. That doesn't mean pushing harder. It's just like with the intention of working on those deeper muscles to try to increase mobility, try to increase blood flow to those areas, getting a lot deeper. Slow, deliberate strokes, direct pressure, and friction. Myofascial release. It's typically supposed to be gentle. The idea is to attach onto the surface layer and give it a gentle pull, which softens and essentially liquefies the fascial layer under the skin. Myofascial release is all about using gentle, sustained pressure. So not really, really deep. It's more superficial, but you just hold that tissue and you sustain it to release areas of fascial restriction. Trying to release the tension and improve the tissue mobility. So the tissue itself, right? So you say you've got somebody who's laying prone and you just put your fingers on their trapezius and you just pull the skin just a little bit and you just hold it. It's typically done with no lotion at all. If you are going to use something, it has to be some kind of tacky, sticky substrate to help you to be able to grab onto that skin and be able to pull it gently. Structural integration or rolfing encapsulates myofascial release, but in a holistic whole body system. So myofascial release is a technique versus rolfing or structural integration that uses myofascial release. Structural integration practitioners view the body as an interconnected system and aim to improve posture, movement patterns, and overall body organization through a series of sessions, which is often 10, where they use fascial manipulation, but it tends to not be that gentle. Usually manipulate and release restrictions, improve the tissue hydration, and create more efficient movement patterns. So that's what structural integration, as opposed to just myofascial release. That's the difference there. Okay, so next is trigger point therapy, which is a kind of deep tissue massage. So trigger points are knots, basically, like a very small constricted area that sometimes when you press on those knots, it will create a referral pattern, and sometimes people just feel it right in that spot. If your client feels a referral pattern, that is like you press on the knot and they can feel it somewhere else, or they can feel it radiate into other areas, there is a general pattern universally where specific areas of knots will refer to. That's how you know that it's a trigger point, is that they feel an unpleasant sensation when you press into it. In trigger point therapy, once the therapist finds that knot, they apply firm, direct pressure on the knot and usually hold it between 30 seconds and 2 minutes. I've heard of somebody needing to hold it longer. I don't usually do that. I just hold it for like maybe 1.5 minutes at a time, give it some space, come back to it and work on it some more. I encourage the clients to take deep, relaxing breaths, and that helps them to release that knot. You can go at a trigger point from different angles, and that can help to release that trigger point. But I don't think you're going to need to know too much about that, except that specifically it's a localized area of tightly constricted muscle fibers that can form as a knot or nodule within a muscle. So not the whole muscle isn't a big knot. It's a knot within a muscle. So that's trigger point therapy. We're going to go into some Eastern modalities that you might be tested on. Shiatsu and acupressure are both philosophies where they follow meridians, those lines of energy within the body, and use sustained pressure in specific places throughout the body to release restricted energy to help it flow effectively for full body holistic healing. The difference between acupressure and shiatsu and reflexology is the philosophy that specific areas on the hands and feet are linked to specific body systems and organs. Now, craniosacral therapy, it's a gentle hands-on therapy that focuses on the craniosacral system, which includes the membranes and cerebrospinal fluid surrounding the brain and spinal cord, as well as the bones of the skull, spine, and sacrum. They use light touch to assess and address imbalances or restrictions in this system, aiming to improve overall health and well-being. So the craniosacral system in this philosophy is functioning to protect and nourish the brain and spinal cord. It includes the membranes that surround these structures, the cerebral spinal fluid that bathes them, and the bones of the sacrum. So they use gentle palpation to evaluate the rhythm and symmetry of the craniosacral system. They believe that restrictions or imbalances in the system can lead to various physical and emotional issues. So it's a whole body holistic system rather than just manipulating tissues in one area. That's the difference between like a Swedish or deep tissue massage or trigger point therapy and a whole body system like craniosacral work or structural integration, Rolfing. So craniosacral therapy is often used to address a range of conditions, including headaches, migraines, neck and back pain, stress, and temporal mandibular joint disorder. Craniosacral therapy is a complementary modality to be used in conjunction with any kind of therapies that have been prescribed by your client's physician. And then sports massage, which is kind of like Swedish, but it's not really meant for relaxation. So let's just talk briefly about pre-event and post-event sports massage. So the philosophy is that before an event, like say you've got some runners that are getting ready for a marathon and there are some sports massage therapists there. They use light, fast-paced techniques to stimulate the muscles, increase blood flow, improve range of motion, and enhance performance and mental focus. And then post-event sports massage uses slower, more relaxing techniques to reduce muscle soreness after all that workout and promote recovery by flushing out waste products like the lactic acid and prevent imbalances ideally performed within 72 hours of that event. So basically it's maintenance for people who are highly physical or athletes. Let's see, are there any other, come on now. So there's Thai bodywork, also it's Thai yoga massage, uses assisted stretching and compressions to improve flexibility and energy flow. It uses a lot of that Eastern philosophy when it comes to energy systems, meridians, and such. Cupping, what is cupping all about? Uses suction cups to create a vacuum on the skin to promote blood flow and muscle relaxation. Okay, well, also there's Traeger as another very popular method of bodywork that uses jostling and shaking to find restrictions in the body and to encourage nervous system relaxation in order to release stuck patterns in the body. And then there's also polarity therapy, which is kind of an Eastern philosophy of balancing yin and yang and making sure the energy is flowing correctly in the body. So those are all some modalities that you'll have to keep in mind for the MBLEx. Now let's go into talking about hydrotherapy and, like I said, what it's for, how it works, how to appropriately use it, and any potential contraindications for your clients. So hot and cold. Using heat is creating vasodilation in the body. So when you have vasodilation, that means the blood vessels are expanding and there are increased circulation, increased oxygen to the tissues. The usefulness of using heat to increase blood flow, increase oxygen to the tissues is it relaxes the muscles, helps support pain reduction, and increases tissue flexibility. So examples of this would be hot packs, heating pads, warm baths, paraffin dips, people love that, saunas, what else? Hot tubs, that's a warm bath. Hot stone, that's another one. Okay, so vasoconstriction is where the blood vessels narrow and circulation decreases. So essentially when you have an inflammatory response, lots of extra blood is getting in there, the white blood cells are attacking, and if you want to reduce that, then you decrease the chance of white blood cells getting in there. So that's why cold helps with vasoconstriction. So examples of vasoconstriction or cold therapy would be using ice packs, cold compresses, ice baths. Also, I've just used ice directly on the skin. And then there's contrast therapy, which is alternating between hot and cold. So a certain amount of time with heat being applied and a certain amount of time with the cold being applied, which pumps the circulation. The blood vessels are closing and opening, and it pumps the blood flow, reduces edema, encourages healing. Okay, so some contraindications for each of these therapies for the heat. So hot hydrotherapy is contraindicated for anybody with open wounds, fever. Obviously, you're not going to be working on someone who actively has a fever. Obviously, you're not going to be working on somebody who has like a very inflamed wound. So those aren't things that you need to be too worried about. But people with severe heart conditions where their blood flow is going to be increased suddenly, that can be an issue for them. Anybody with malignant tumors, you want to be super careful with. Patients with any of these conditions should avoid hot water therapy to prevent infection, pain, or worsening of an underlying condition. So be super careful. Infections and open wounds, don't use heat on them. That's the biggest thing, I think, for massage therapists. Okay, so for contraindications for cold hydrotherapy is people with, once again, cardiovascular conditions, just like the heat. We don't want to make dramatic changes in people's circulatory systems when they have significant cardiovascular issues, heart disease, pacemakers, poor circulation. Okay, so people with Raynaud's already have issues with circulation, so we're not going to make that worse. Anyone with an open wound or infection, impaired sensation, or cognition. People with impaired sensation or cognition aren't going to be able to tell you if they're feeling numbness because they already are numb, right? You want to get feedback from both cold and hot hydrotherapy so that they can give you feedback on whether they feel burning, whether it's just too uncomfortable, because those are important indications of whether or not you're on the right track when it comes to using hydrotherapy. So definitely anybody with impaired sensation, don't use that. And then there are people with cold hypersensitivity. People with multiple sclerosis have a hard time with hydrotherapy because they've lost the myelin sheath over a lot of their nerves, and so it can cause some cold and heat hypersensitivity. So keep that in mind. How to use hot stone therapy safely. What I heard was the biggest injury that is reported to our liability insurance companies that cover massage therapists are burns from hot stones. So keep that in mind. The stone temperature should be between 120 and 130 degrees, and check with a thermometer before and during use. Make sure and test it on your own skin first before you apply it. It's one thing if you're just going to swish it around on somebody's skin, but if you're going to leave that stone on their skin, you have to have a protective barrier to keep that heat from radiating in and damaging tissue. If you're using hydrocollator packs or a heating pad, then be sure to use towels in between, first of all, to prevent any kind of contamination from one person's skin to another person's skin, but also to protect their tissue from the heat building up and burning them. Let's see. And hydrocollator safety. Hydrocollator packs, the standard is between 160 and 165 as the temperature that's safe to use. Anything over 170 is just too much. But yeah, be sure to use towels, at least 2 towels, to make sure that there's a safety for your clients. Hot towels, just make sure and test those on your own skin before you apply them to your clients. And once again, the kinds of cold hydrotherapy that you could be using are ice packs, cold stones, cold water, just straight ice on the skin. Oh yeah, and ice immersion, ice baths for like the hands or the feet if you have some chronic tendonitis for those people. That can help to numb their pain. Let's see. So obviously cold is cold, right? Cold is cold. So we're not going to concern ourselves with temperature ranges. So it's recommended to keep an ice pack on for 15 to 20 minutes tops. Now, regarding using just ice therapy, where you're putting ice directly on a localized area, keep it moving. That's the big thing. It's just or ice stone, right? You just keep it moving. Don't leave it sitting on the skin, or it will freeze the skin and damage the tissue. So I just use a towel for all that melting ice, and I just keep it moving. So I walk my clients through the sensations that they're going to be feeling. And when we get to the point where I go to tickle their skin and they don't feel anything, they're like, okay, I don't feel anything. That's numb. That's enough. Right? Because if you just keep that ice on that spot for too long, you're going to damage the tissue. So I don't go longer than 5 minutes using direct ice on the skin. So that'll give you a good benchmark if you get a question about that. Let's go ahead and start with asking questions about modalities of bodywork and massage. Which of the following lists correctly identifies the 5 classic strokes of Swedish massage? We have A, effleurage, petrissage, tapotement, friction, vibration. We have B, which is compression, rolling, shaking, stripping, percussion. We have D, gliding, kneading, shaking, pinching, compression. And D, raking, slapping, tapping, rolling, stretching. All of those things sound like they feel wonderful. But what are the 5 classic strokes of Swedish massage? They are effleurage, petrissage, tapotement, friction, vibration. So the way that I would know which one this is, effleurage is the number one Swedish massage stroke. Okay, which modality of bodywork is primarily focused on injury prevention, enhancing performance, and supporting faster recovery? So let's go through and figure out which ones that it isn't, which can help us to identify which one it is. So let's look at the question. Injury prevention, enhancing performance, supporting faster recovery. Those are the primary focuses. We have A, reflexology. We have B, sports massage. We have C, craniosacral therapy. And D, myofascial release. So we know that the primary focus of reflexology is to enhance the function of vital organs and body systems. We know sports massage is all about enhancing performance or helping athletes to be able to function their best. Craniosacral therapy is about supporting the flow of cerebrospinal fluid. And we know myofascial release is about releasing restrictions in the tissue. So B, sports massage. That was a pretty easy one. Another bodywork question is, which modality uses gentle, sustained pressure to release restrictions in connective tissue and improve range of motion? We have A, myofascial release. We have B, trigger point therapy. C, shiatsu. And D, reflexology. So let's look at the question again, and we can identify which ones it isn't through looking at the information that we're getting from the question. Gentle, sustained pressure, releasing restrictions in connective tissue, and then also range of motion. So if I was to start with D, the bottom one, reflexology, I know reflexology is about enhancing the function of vital organs and body systems. It does use sustained pressure, whether it's gentle or not. That it depends on how sensitive somebody is. Sustained pressure is part of it, but it's not about connective tissue and range of motion. It's about body systems. Shiatsu is using sustained pressure as well, but it is for increasing energy flow, not about connective tissue. Trigger point therapy is about releasing restrictions. It is about improving range of motion, but it happens as a secondary effect of releasing knots. And it's not gentle. It's firm, right? So myofascial release by default has to be the one, but we already know that it's using gentle, sustained pressure to release restrictions. So A would be the best answer for this question. Okay, so let's do some questions about hot and cold hydro. So cold or ice therapy is generally contraindicated for clients with which of the following conditions? We have A, acute inflammation and recent injury. B, hypertension and cardiovascular disease. C, anxiety and insomnia. And D, muscle spasms and edema. Contraindicated, okay? So if I look at C, anxiety and insomnia, the benefits of ice therapy don't include helping with anxiety or insomnia. They're just an aside, but they're not a contraindication. Okay, we're looking specifically, contraindication means that it's dangerous or unsafe in some way to use hydrotherapy or to use that cold therapy on a client. So we're looking for that specifically so we can get rid of C. Muscle spasms and edema, we know that cold or ice therapy is beneficial for muscle spasms and edema. We're going to get that out of the way. C and D are gone. A, acute inflammation and recent injury. We know that when somebody has a strain or a sprain, what are the things we use? Rest, ice, compression, elevation. So it can't be A. And by default, it has to be B. Hypertension and cardiovascular disease are contraindicated for cold or ice therapies because it changes your circulation. Okay, so here's a question. How long should a localized ice application typically to be used on a client to reduce inflammation without risking tissue damage? So I think specifically this question is not asking about how to use ice directly on the skin. It's talking about using an ice pack because our choices are, well, there is a choice for 3 to 5 minutes. Okay, so I would choose 3 to 5 minutes for direct application of ice. But generally, if you're using an ice pack with a layer of protective covering over it, then that's going to be 10 to 20 minutes. Shorter applications of 3 to 5 minutes with the covering isn't going to provide adequate vasoconstriction, while longer than 20 minutes is going to increase the chance of frostbite. So yeah, I would look at that question very carefully. How long should a localized ice application typically be used on a client to reduce inflammation? I would, if it said how long should a direct ice application typically be used on a client to numb an area, a local area. So that would be the 3 to 5 minutes. But if it's, yeah, I would just pick that question apart and try to get the best information out of the question in order to be able to answer like the context of what answer they're looking for. So here's a hot hydrotherapy question specifically about hot stones. Like I said, that's super important for insurance companies and super important to the people that create the MBLEx. We don't want to be hurting people. Which of the following represents the safest application of hot stones during a massage session? A, placing hot stones directly on bare skin for maximum heat transfer. You might have some clients that want that, but it's not safe. B, placing hot stones without checking the water temperature. We always check first. Placing hot stones on the body with a protective barrier, such as a towel or a sheet. Or D, reheating stones in a microwave for quick use between clients. That's something I didn't mention in the previous discussion, was how to appropriately heat those hot stones. So let's just do that real quick. Hot stones have to be heated in an appropriate receptacle. It has to be heated in a device that's specifically intended for hot stone use. Using a crock pot isn't appropriate unless you're able to monitor that temperature. And sticking it in a microwave isn't appropriate at all because you can't tell the temperature on it. So yeah, we don't use microwaves for that. We use the appropriate device for that. So D is out. C, placing hot stones on the body with a protective barrier such as a towel or sheet is a good possible question. And then let's look at the other options. B, using hot stones without checking, like we always check the water temperature, and placing the stones directly on the skin for maximum heat transfer isn't our goal with hot stones. We're trying to just be safe. The first thing is be safe. And the second thing is to increase vasodilation in the area. Maximum heat transfer isn't the goal. So safest application, the question asks safest application. A is not safe, B is not safe, D is not safe. The safest application, the best possible answer would be C, placing hot stones directly on the body with a protective barrier. Okay, so this is where we're gonna close out. If you love this video, make sure and subscribe. Make sure and get your freebies in the description below. and check out the next video that's going to be coming up. It is going to be our last video all about muscles of the leg and foot. That's the last in the 6-part series. So make sure and check that out coming up next. All right, I'll see you then.